Okay, hello and welcome, members of the Chinese Medicine Practitioner Meetup Group, hosted by Kamwo. My name is Thomas Leung. I'm the organizer and your host for this afternoon or evening, depending on where you're logging in from. I want to take a moment to welcome new members to our group, especially anyone from ASNY, Acupuncture Society of New York. I hope you enjoy what we have for you tonight, and hopefully many more events in the future. The mission of our meetup group is to connect members with respected authorities on subject matters within our profession. The events are always free, and our speaker suggestions come from you, the members. So if you have suggestions for speakers, please send them to us. This is our 134th event, but it's only our 12th online. So it's still a relatively new thing for us. For those who are big fans of live meetup events, in person, it will be resumed at some point, hopefully sooner than later. However, because of the enormous reach of our online platform, we will most likely incorporate that aspect of live streaming into the in-person events. By attending tonight, each of you will receive a $20 coupon via email. So please look for the email that will be forthcoming in the next couple of days. Look in your spam folder, okay? So if you don't get the coupon. So here's some ground rules. Please mute your microphones, but please feel free to leave, and I would even encourage you to leave your camera on, as we actually did a meetup survey, and it indicates that it is a morale boost to see other people's faces within our community when we're sharing this space. So I guess the pandemic really shows that we need that connection to people. So I just want to pass that on. So feel free to leave your camera on if you wish. Anyway, as for questions, please hold off any questions until our guest speakers come to a pause and give us the cue to ask the questions. And of course, there will be a Q&A session toward the end. If it's something urgent and relevant, please type a comment on the chat box or raise your hand, and I, as your host, will address this. Tonight, the lecture will be about 1.5 hours or so, and so it'll be run up until about 8 o'clock. Tonight's talk is co-sponsored by ASNY, Acupuncture Society of New York, which many of you are probably familiar with. Some of you may know of the good work that they do, and some may not. Well, for those who may not, let me assure you, ASNY has been in the forefront fighting for our profession's interests for a long time. And then who are these people? They really just made of regular acupuncturists like you and me, no special powers, just a willingness to donate their time and money to a thankless job. And speaking of a selfless person that donates her time to the cause, let me introduce my colleague and longtime friend, Amy Hausman of ASNY. Amy has been in private practice since 2008. She's currently working on the launch of her newly expanded clinic, Be Well Katona, set to open in late September. Amy has been a longtime advocate for our profession, acting as a student council president when she attended PCOM, Pacific College, building community by producing TCM conferences. And now she is the interim vice president of ASNY. So Amy, welcome.
Thank you, Tom. Thank you for saying it's a thankless job.
I'm not lying.
Hoping to change that. So yes, thank you. And we're always looking for more volunteers. So please reach out if you want to be a part of our community. I am very thrilled to be here tonight to co-sponsor tonight's featured speaker, Sharon Weizenbaum. Sharon graduated from the New England School of Acupuncture in 1983 and since then began practicing in Western Massachusetts. From 1990 to 91, she lived abroad in Hangzhou, People's Republic of China. Please forgive me, Sharon, if I mess up any of these pronunciations tonight. Studying Chinese herbal obstetrics and gynecology with Dr. Chu Xiaomei and Dr. Cheng Yufeng, as well as the Chinese language. Sharon has also delved deeply into classical formulas, studying in China with Dr. Huang and inviting many teachers to teach at her very own White Pine Institute, including Dr. Huang, Feng Shilun, Fu Yanling, and Nigel Dawes. Sharon has a very unique approach to classical formulas and diagnosis through her graduate mentorship program. She has taught internationally and is a published author on many articles of on East Asian medicine. She founded the White Pine Circle, which is both an educational platform and a community of teachers and practitioners. So it is with a great honor to welcome Sharon, her generosity of spirit and knowledge as she speaks to us tonight. So let's give a great wave of applause as we welcome Sharon Weizenbaum. Thank you.
Okay, well, thank you so much, Maureen and Tom, for having me here this evening. I hope that this talk will leave you with some clinical gems that you can take right home and start working with. You know, as you see, I graduated from acupuncture school in '83, so it's been almost 40 years since I've been practicing. And what I'm trying to do with tonight's lecture is to really pull out some things that have been really helpful to me, you know, that have taken me a long time to figure out, but have been really helpful for me with working with people with depression and emotional disorders. So I'm gonna just start by sharing my screen, and I also really welcome questions, and Tom is going to be monitoring the chat and sort of picking the right time to read your question out loud. So really feel free to ask questions at any time. As Maureen said, as Amy said, I have a somewhat unique way of thinking about working with classical Chinese medicine that you'll, start to understand through what I'm teaching today. And, so it might be a little bit wonky to you. And so again, please feel free to ask questions. My hope is that you'll say, oh, that makes so much sense, but we'll see how it goes. So, okay. So what we're going to be doing this evening is first, like, what is depression and what are emotions? And we won't spend a lot of time with that because I want to kind of get down to nitty-gritty clinical application, but I do want to sort of set the stage for some definitions in terms of how I think about these things. And then we'll go to look at the primary patterns that I see for depression, and I should say anxiety, which depression sometimes manifests as anxiety, and what these patterns look like in the clinic. One thing that is important to me as a practitioner is not being vague about what I'm seeing. How do I know this is the pattern that I'm seeing? It sort of looks like they have kidney deficiency. I want to be more clear than that. And, so I'm going to be sharing, like, these are the things I look for to really definitively say, yep, this is a kidney deficiency pattern. So I'm going to try to be sharing some of that, like where you can go back to clinic and say, oh yeah, this is what she was talking about. I definitely see this. So here is a list, which I'm not going to read, but it's just from the web of the Mayo Clinic site. And these is their list of symptoms that come along when people are diagnosed with or consider themselves to be depressed. So I put some of these in bold and italics to highlight them. And so the first one that I highlighted was feelings of sadness, tearfulness, emptiness, or hopelessness. And then over on the right, you can see that I put the word placidity. And so what I'm doing here is looking at these kinds of symptoms that people come in with, and then looking at that energetically, because that's what we do. We want to look at what I call the elemental physical of these, emotional experiences people are having. So when the patient comes in and they say, I'm suffering from depression, what exactly is going on with them? Do they have a flaccidity, sort of a weakness that they just can't sort of pick themselves up? Then angry outbursts, irritability, or frustration. So is there a lot of energy that's pent up inside that they maybe don't know how or can't express? And so is there like pushing out? Is there something inside that's built up and it's pushing out? And this is just to give an idea of like, what exactly am I looking for? And so I like to work with my students to really look at the emotional expression that people are coming in with and ask themselves, what's going on here? Energetically, what's going on? Wow, it's so flaccid, or wow, there's so much pent up in there that they feel they can't express or they don't know how to express. Are they tired with a lack of energy? And you can see then the next thing I wrote on the right is the life force isn't available. And I use that idea of it not being available on purpose as opposed to the life force being weak, because often, depression can come with extreme fatigue and lack of energy, but that doesn't necessarily mean that they're deficient. That can easily mean that their life force is blocked and not available to them. So, if somebody comes in and they say, I'm so tired, I have no energy, in my mind, I'm thinking, oh, their life force isn't available. I wonder why. And then the rest of the diagnosis is going to help reveal that. And then anxiety, agitation, and restlessness. And so this points to the idea that often with depression, we think of it as like a kind of flat, blah, I'm not motivated, I have no joy. But very often people who are diagnosed with depression, or who even define themselves as being depressed, combined with that kind of flat, dead feeling, there can be a lot of anxiety, agitation, and restlessness. And so we don't want to limit the idea of depression. Certainly, we don't want to jump to any conclusions like liver qi stagnation, which is a common one, partly because of the Chinese and the characters that mean depression can also mean this kind of constraint. So anyway, I have the word on the right, hyperactivity, like where I see some kind of life force, qi, that's out of right relationship and is, hyperactive. There's something running their body around that's very uncomfortable and it's very hyperactive. So the life force can be restrained, or the life force can be out of right relationship, as you'll hear me say many times. In other words, the life force doesn't have a good home, and so it's kind of running reckless as a hyperactive kind of energy. And then the next one down is feelings of worthlessness or guilt, fixating on past failures or self-blame. And so what I call that is thoughts. Like people come in and they have lots of thoughts that come in and are really harassing them. And I consider these thoughts to be almost like an external evil. They come from the outside, even though people kind of identify with they're my thoughts. These are things that I'm thinking, they're my thoughts. But if we think of them as sort of coming in from the outside, so a thought comes in that says you're worthless, that has an effect on your body's energy. So it's important for me as a practitioner, I'll talk about this a little more, to really look at some of the thoughts that are coming in and pulling people around in all kinds of different directions. So sometimes, for example, let's say somebody's kidney yang deficiency, and so they come in with depression, their physical energetic is contributing a lot to their depression, and the thoughts may be secondary, like, wow, I'm so depressed, my life is worthless. Other people come in and the thoughts are the reason why their body energetic is so disordered. And so it's important for me to look at the extent to which thoughts are pulling the body around, or the body is contributing to the thoughts. And so, that can be difficult to ascertain, but as you get to know people more, you start to get a clearer idea. But I always kind of consciously kind of create a percentage, like 50-50, or wow, the thoughts are like 80% and their body is 20%, or vice versa, just so I can be clear. Yeah, so I'll say a little more about that. So what are emotions? Like, we talk about emotions a lot, and emotions certainly are not Shen, and we'll talk about Shen in a little bit. My definition of emotions are an energetic movement in the body with a story attached to it. So for example, let's say again, I have kidney yang deficiency and I'm really exhausted and I'm cold. Maybe I have some water swelling in my lower body. And one person might come in and say, wow, I'm really cold and I'm really tired and I have water swelling. And yeah, I'm worried about that. But someone else might come in and say, I'm really depressed. I have no joy in my life. I'm really depressed. And so to me, that's when there's an emotional story attached to something that is actually just an energetic movement. So someone might feel a lot of pent up energy and come in and say like, oh, I feel so pent up, like I just want to explode. And someone else might come in and say, I'm really angry at my partner. They have much more of a story attached to it. So for us as practitioners, or for me, I want to look at the energetic movements and sort of separate out, okay, that's their story about it. I'm depressed, I'm anxious, I have this whole history about why I am, and that's okay. But I want to see the energetic of it, because that's what I'm applying the herbs to. So as a practitioner, I can try to hear the story as just a story, so I can see and feel the energetic behind this. And this is what I call the elemental physical. So I really try to help my students, like, what's the elemental physical? So you don't just think, oh, they have anxiety. How do I treat anxiety? Well, what is it? Is it a hyperactive chi? Does it feel hot? Does it move up? Does it sink down? Does it grip in their epigastric area? And it's often actually really helpful to the patient too, to kind of come into their own body when you ask them, like, what does it feel like in your body? Often they've never been asked that before. And so it can be actually really helpful to get people to become a little more embodied. Okay, so one of my teachers, Sharon Weizenbaum, gave me this idea, like, put the pencil down. And so what he means by that is that, as a diagnostician, I don't actually care about their story. I care about the energetic, like they're going through a terrible divorce, they've had this kind of trauma or whatever. Like, as a diagnostician, that is really meaningless to me. But as a human being, it has meaning. So kind of differentiating information I'm gathering as a diagnostician versus being a human being and I want to listen to your story. So putting the pencil down is like, okay, I'm stopping being a diagnostician. I'm just, tell me about how things are with your husband, and we can decide how much we want to listen to stories, how much it's appropriate for who we are and who the patient is. And it's very wonderful for patients to have a place where they can tell these stories that's a non-judgmental space. But also, they don't necessarily know what's supposed to happen in our visit. And so they come in, I'm depressed, and they're sort of used to going to a therapist or to a medical doctor. So they start telling you all this stuff about their history or about the meds that they're on. And actually, it's not helpful for you diagnostically. And I find that often patients are really relieved when I direct the visit. Like, actually, what I need to know is about your physical experience. And they're coming to me because they want to get help. And so they want to know, what do I need to know in order to help them? And so, being able to be clear and have those limits about what I listen to so that I can get to the information I need, it's important. And I find often patients are relieved because they're like, I'll tell you anything, but I don't know what you need. And if I'm really clear, like, actually, this is what I need, it's a relief for them. So, and just, we don't need to compensate for insecurity about being practitioners, which all of us have, with over listening to people. But what we can see when people are telling their story is we can observe how their story pulls their energetic around. I just had a patient today whose main complaint is depression and terrible insomnia, which is, of course, related to her depression. And I could just watch how the story that she has pulls her energy and tightens her energy. And so, I'm giving her herbs which are helping with the energy, and I'll probably mention this case as I get to the formula that I'm using for her. But I also have talked to her to notice what the story does to her energy and to begin to help her to just work with, is there a different story we could have about what's going on for you? Okay, so I'm observing the life force in the wheel with a cool eye. And what I mean by a cool eye is an eye that is not involved with the story. So as a compassionate human being, I can feel for people's suffering. But as a diagnostician, we have to have a cool eye so we can see what's going on energetically. And for me, that cool eye is actually the heart of compassion, because it's so functional and we want to relieve people's suffering. So I'm asking myself questions in the intake, like, is the life force or the yang like hyperactive and going up and out? Is that due to some kind of deficiency, like the life force that doesn't have what it needs to be grounded and store? Or is that due to an excess, meaning that the life force is being blocked from grounding? And I'll explain what this means as we go. Like, the life force is trying to come into my body and it can't. It's staying up above because it's being blocked from coming in. So if it is blocked from coming in, where is that block? What's blocking it? I want to be able to find that so I can unblock it. Or is the life force weak? And if it's weak, like, which zong is weak? Like, what's going on in the body that's weak? So I'm looking for all of this. Oops. So I already said this, that I rate the story versus the physical. How much is the story pulling the energetic around? How much is the energetic contributing to the story? And, you know, and the more the story is contributing to the energetic, in a way, the more difficult it is, because as practitioners, we work with the body, and the body, of course, affects the mind. But if people have a lot of mental habits, and we're not therapists, you know, they'll need help with their mental habits. And of course, we can help with that, and we can be supportive of that. But sometimes people need help from people who are really professionally trained to work with that kind of thing, like therapists. But hearing the story as just a story, it has its benefits, because we can then see, like, oh, this person has this story that they keep telling themselves. And when we see it as just a story, my experience is that I can start to see the well-being that is being messed with by the story. So my eye can go to that well-being and then see, like, wow, this story is just really jerking things around. And I already mentioned that I see it as this external influence. So I can speak to the well person who's being influenced. So in a way, I'm saying the patient is not depressed, but is afflicted by depression. Like someone well is afflicted by depression. And so how do we see and free up their true nature? And so even though I'm not a therapist, by keeping this eye on their wellness and their true nature, I can benefit them and their ability to come home to themselves. You know, we don't want to jump into the, you know, that we want to support people, then really acknowledge that they're suffering. We don't want to jump into and join the battle against the depression. We want to instead have an eye for the well-being and promoting that well-being. So we'll see what that means very specifically as we go on. So some issues can be very depressing. Like if someone has insomnia and they haven't slept for years, then the issue might be the insomnia and not so much the depression. And so we want to have an eye for, what can I fix that might really help the depression? Like if people can't digest and every time they eat, they feel bloated and distended, that's really important to fix. And people can feel a lot happier when their digestion's working better. Someone has night sweats all night long, that can really affect their spirit. If someone has a lot of pain, or these are just little examples, but a lot of physical ailments can contribute to depression. So we don't want to forget and just see the depression as the main complaint when there's important other things going on. And ultimately, our herbs are working with the body. And I've been amazed over time how profoundly effective the herbs are in things that just felt so recalcitrant, you know. And when you correct the energetic, the well-being, it's almost like well-being is just waiting to come back. And if the things aren't set up for it to take up residence in the body, and when you open up the energetic, it's like, so, and I think that's part of the beauty of working with classical formulas too, is that it works with that energetic. So when I talk about what's happening with the life force, and that's what I'm looking for, what's happening with the life force. And here I call it the life force yang. And the reason I call it the life force yang is because the life force is yang, because when we're dead, we're cold. When death is not represented by a deficiency of yin, right? There's a body there that's pure yin. It's marked by a deficiency of life force. So we're not warm anymore. There's no movement. We have no yang quality in our bodies. anymore. And so for me, like my take on the classical physiology, according to the Shang one, is that the yang, this life force yang, is actually something that's pouring into us constantly. You know, that we're connected to heaven, and this life force, which is warm both physically and spiritually and full of intelligence, it's pouring into us all the time. And so you can see the yang is coming down from heaven, and it comes down and it roots into my Ming Men, which is a place in my body. So it comes in, it actually pivots and changes direction, and now it's in right relationship with the physical aspect of my body, and it gets, the life force gets infused into my physical aspect, and it then gets expressed. You know, so when you see a person like me, you're looking at that yang that's inside the yin coming up and out and being expressed. But it also came down and in from heaven. So the life force yang is coming down, rooting, and then integrating with the yin aspect and coming back up again. And this is constantly turning. And it's especially affected by, in the most obvious way, it's affected by the apparent movement of the sun around the earth. You know, so my life force yang rises up in the morning and, you know, is active during the day, and then it descends and roots and then hibernates through the night and then comes back up again. So we sort of have this picture of the life force constantly circulating. In the most obvious way, the day and night cycle, but there's many cycles of yin yang going on in our bodies all the time. And so we're going to be talking about the conformations, and the primary patterns that I see. I'm going to tell you about Fuzhi patterns, Gui Zhi Tang patterns, cold blood patterns, warm blood stasis patterns, and Chai Hu patterns. I hope I have enough time. So Fuzhi patterns, I would call this dark depression. And I ask questions like, you know, okay, you're depressed. Do you feel like there's an absence of warmth or light in your heart? And so often with this kind of dark depression, that seems very clear to people. Or you can say, you know, do you like see a sunset or somebody you love, and you know you should feel this warmth, but you don't feel any warmth. You don't have that feeling, that juicy, warm, connected feeling in your heart. Now that can come from other patterns, so I definitely want to see kidney here, but it's very, when there's a kidney yang deficiency type of depression, it's often this kind of dark depression. It's a real lack of joy. I think of like E.T., and E.T. has, you know, like his heart like glows red when he's with Elliot, you know, and we all have that. Like that's what it feels like to be touched and moved and to love people and beings in life. And so when that light is down, you know, it's very painful when you can't feel warmth, and that is a kind of depression. It's very common. So for these Fuzhi patterns, and of course there's all kinds of formulas, right? Suni Tong and Fuzhi Tong and Zhenwu Tong, types of formulas. And from a Zanghu point of view, I would call this kidney yang deficiency. And the symptoms that I look for are weakness in the lower body, weak pain in the lower body. So there might be pain in the lower body, but it has to be a weak kind of pain. So low back pain is not kidney. It's weak, lower back pain. Lower abdominal weakness, the abdomen is very helpful. Like a big empty feeling in the lower abdomen, or muscle tension. If the rectus are very tense, it's actually tense. It's compensating for the weakness that's there, and it's protecting the lower body by being really tense. Or a chopstick, which you feel in on the midline, and you feel this central tendon is like a chopstick. Another sign that I look for is a dip in the back of the tongue. Of course, the tongue goes down in the back, so it's not just the tongue going down in the back, it's actually a dip in front of that, that I see as a, for sure, kidney sign, not necessarily kidney yang. So these are for sure kidney signs. And then they're with these cold, dark signs. And so the person feels cold. They have cold affect. They have cold emotions. Also watery diarrhea with undigested food. Another one I would add here is like pitting edema along with the kidney signs. And so then in that case, this you would explain the depression with the kidney yang deficiency and use a FUDZA formula. I remember somebody coming to me for depression, and it was so obvious. She was so cold and she was really pale. She had dark circles under her eyes, which aren't always kidney, but she had plenty of kidney. Weakness in her lower abdomen, weakness in her low body, like everything was kidney yang deficiency and depression. She also had cold blood stasis, and I ended up giving her a modified shortened form of Wen Jing Tang with Suni Tang greatly integrated into that, which means that I use Ganzhang in the formula instead of Shangzhang, and I added the FUDZA, and it already included Jigansao. And FUDZA is just amazing because I'll show you a picture of what it does in a moment, but it's like bringing that ET throbbing of warmth into the heart. Like you start feeling warmth and joy. So here, this is a Shaoyin deficiency. The heart yang is also not being warmed by the kidney yang. And so when you give the FUDZA, it like turns that light back on and brings that warmth back into the chest. It's lovely. So here's a picture of FUDZA down in the lower part of the circle. So when you have a FUDZA pattern, what's happening with the life force yang? And I have FUDZA that down there in the lower part of the circle. And so this is really the question, because FUDZA is a Shaoyin herb. What is the Shaoyin great sweeping motion? So this idea of a great sweeping motion must sound really weird, and but this is what we work with the classical formulas, which is in a Zongfu way, we have kidney yang deficiency, but the Shaoyin, all of the conformations I think of as great sweeping motions, and that when you're sick in this Shaoyin way, the great sweeping motion of Shaoyin is not happening. And this motion is this arrow. So it's from heaven down into my ministerial position, down into my lower body. So the warmth comes through my heart down into the kidneys, and FUDZA draws yang from heaven. It almost is like a magnet, So there's yang in heaven, and it's going to connect me and bring that yang deep into my body. And also FUDZA, it helps you store yang. and it takes that yang and brings it back up to your heart. So the great sweeping motion of Shaoyin is from the heart down to the kidney. And so Fuzi is it's encouraging that motion in the body. We could say it tonifies the kidney yang, but from a classical perspective, from my point of view, it's actually promoting this motion from heaven down into my Ming Men and helping to store it there. And then it's like, now it's stored. It's almost like it's stored in your wood stove, and you have your dampers nice and closed. Now it can warm your whole house, you know. So that's what Fuzi does, this wonderful herb. So I hope that's clear. Any questions so far? Okay.
No questions so far.
Okay. So the next one I want to talk about are Gui Zhi Tang patterns. And so first we're going to talk about the yin and the wei, and what are the yin and the wei, and what is the yin wei disharmony, and how does this affect the emotions? This is so common for people. I can't even say how many times I've given Gui Zhi Tang, and it can be so helpful, and it's such a simple formula. It's just beautiful. So, you know, we talked about the Shaoyin, bringing the yang down from heaven and rooting it down in the lower body. And so that once the yang is down there, it can harmonize with the yin. And when yin yang start to interact, what happens is that yang starts lifting the yin up, and that's represented by the left side of this circle. It starts lifting that up, and it actually, the yang within the yin becomes the liver blood, which is a liquid that's red and warm and moving up in the body. So we have the kidney yang and yin interacting to create the liver blood, and which is the yang heat inside the fluid, and that's what blood is. And then that blood keeps going up and out in the body, and it becomes the wei yang within the yin yin. Hold on. Hey, Duna, come here. Thank you. Okay, you stay. Sorry about that. So the wei yang is inside the yin, and it's like steam that goes to the surface of our body. And the definition of steam is that it's hot water, and that's what makes it go up and out. And what happens if you take the yang out of the yin is you get droplets of water, right? And what happens if you take the yin off the yang, you get flushing heat, right? When you separate them. But when they're together, it creates this beautiful, like, ozone layer of protection in the upper body, especially in the heart, this ozone layer of protection. I'm going to just close the door. So we have that picture of this harmonized yin and wei coming up and firming up our pores and bringing moisture to our hearts, this warm moisture to our hearts, nourishing our hearts. So then we have also a disharmony of the yin wei. That's the harmony of the yin and the wei, where the wei is inside the yin and lifting it up to the surface and to our upper body. So a disharmony of the yin and wei is where they come out of this yang within yin relationship. So the yang without the yin is going to be a kind of flushing up in the body. And that is very often experienced as anxiety. It affects the heart, and it can create palpitations. The yin coming out of right relationship with the yang is, what's a symptom for Gui Zhi Tang in the Shang Lun? Sweating, right? So kind of sweating and anxiety, palpitations, flushing up kinds of symptoms. So this is very, very common. And it also, because the yin and the wei are not in harmony with each other, so you don't have this nice ozone layer of protection around your heart, there's a very vulnerable feeling. So often, someone might have PMS or something, and they get a lot of anxiety, and we might think, oh, they're having PMS, that's, liver qi stagnation. But actually it's a Gui Zhi Tang pattern, because they get weepy and anxious and vulnerable and everything, they someone gives them the finger and they start crying, because their hearts are so open and vulnerable. So this is the kind of the Gui Zhi Tang pattern. And one way to think about it is, if you're somewhere and your ex walks in with their new girlfriend, and what do you feel? You feel suddenly like hot, you flush, you have palpitations, you start sweating, you feel so anxious. That's a Gui Zhi Tang pattern, and then your best friend comes over and just says, oh my God, you're so much prettier than her, and I've heard terrible things about her, and then it's like bringing that warmth back into your heart, like, okay, I'm all right, and, so you're getting a treatment from your friend to help bring your yang back into right relationship, and you feel a little better. And you could imagine some things that might make that worse too. Anyway, so sometimes, we think of Gui Zhi Tang as like for colds and things like that, but it's for so much more than that. And very, very effective for working, especially with anxiety, where there's a kind of hyperactive feeling, and especially if there are like heart palpitations. So we want to bring that yang back into the yin with Gui Zhi Tang. And so there's a bunch of Gui Zhi Tang formulas, like Gui Zhi Jia Gui is a formula in the Shang Lun, and it's a formula when there's even more upsurge, so even more flushing or more palpitations. And it says in the text that it's from like a hot needle coming in, which basically is code for you've had a shock. So people will come in and they might have a Gui Zhi Tang pattern, but then they have a shock and now their palpitations are even worse. They got in a car accident or something and they can't kind of come back down again. And so Gui Zhi with even more Gui brings the yang back in even more. There's another one, Gui Zhi Jia Shao Yao Tang, which increases the Bai Shao. And that's I use that formula so much because the Shao Yao really integrates the idea of Shao Yao Gan Cao Tong, which is really tense muscles. And so often the need for additional Shao Yao, Bai Shao, will show up on the rectus abdominis being very tight, or with very tight muscles, especially in the upper neck, upper back and in the neck, because those are the Taiyang channels. And when you give Gui Zhi with some extra Bai Shao, those muscles relax. So a lot of people feel anxiety and they have a lot of tension going up their neck and even into their jaw, like TMJ kinds of things. So Gui Zhi Jia Shao Yao is very, very nice for that. Then we have Gui Zhi Jia Longgu Mu Li Tong, which even more adds the Longu and Muli to Gui Zhi Tang to really settle and calm. And one of the main reasons I might add Longu and Muli is if the sweating is very strong, like night sweats, or I get palpitations and I sweat so easily. Or if there are strong sexual issues involved, then I might even add Rogui to bring that yang down to the Ming men, and Longu and Muli are going to really help consolidate the yang in the lower warmer and just in a very sweet way warm that. And also if there's any kind of excessive bleeding or vaginal discharge, Longu Muli can help to stop that. Of course, then there's Gui Zhi Fuzi, which sort of integrates what we talked about earlier. You can add Fuzi to Gui Zhi Tang. Xiao Jianzhong Tang is Gui Zhi Jia Xiaoyao Tang. It has double Xiaoyao, but it also adds the Yitang, the maltose, and I'll often use Fu Xiaomai. Actually, today I gave someone Gui Zhi Da Longu Muli Tang, and I added Fu Xiaomai, which integrated Ganmai Da Zao Tang, if you know that formula, which is for kind of crying all the time. And all you have to do is add Fu Xiaomai and you've integrated Ganmai Da Zao Tang, but also you could use Fu Xiaomai instead of, and actually I integrated Xiao Jianzhong Tang because I used more Bai Xiao. I increased the Bai Xiao, added Fu Xiaomai, and I saw Fu Xiaomai as the Yitang, if that makes sense to you. So easy to take Gui Zhi Tang and morph it to fit the needs. And of course, we'll talk about this with the cold blood. Wenjing Tang includes Gui Zhi Tang. Gui Zhi Tang is inside of Wenjing Tang. So we'll talk about the cold blood scenario in a moment. So in diagnosing the Gui Zhi Tang pattern, we can look at symptoms, but symptoms can be a little bit misleading. So I'm going to tell you sort of how I do it, which is I look for spleen dry deficiency, and that's going to be tending to cold. And the reason I look for this dry deficiency of the spleen is because, look, in the formula, I've got Dazao and Zhigansao. It moistens the spleen, and it's tending to be cold because I have Shang, which goes right to the middle jiao and warms it. And Gui Zhi also warms the middle jiao. I'm looking for blood deficiency because the formula includes Dazao, Bai Xiao, Zhigansao. It includes Xiaoyao Gansao Tang. So I'm looking for those tight, undernourished muscles, especially in the neck and upper back. And just for a moment, we'll talk about aversion to wind, because in the Shanghanle, an aversion to wind is a key sign for Gui Zhi Tang. And if you ask people, do you have aversion to wind? You'll be surprised how many people say, yes, I always wear a scarf. I hate the wind. That means their surface is too open. But wind is also a symbolic idea that is aversion to too much going on, like it's too hectic. I get overwhelmed really easily. I don't want to go to a big party. There's too many people. There's too much stuff going on, and I get overwhelmed and I have to retreat. So we can take that idea of wind a little bit beyond just the physical wind. And we know that we treat this open surface because Shangjiang and Dazao are a little yin-yang symbol where the Shangjiang is in the stomach and Dazao in the stomach, and it steams up that juicy Dazao and creates that kind of steam. And Shangjiang creates that steam that goes up to the surface from the stomach. And Gui Zhi and Bai Xiao are exactly the same. except that they go into the blood and warm the blood to create that nice steam. So both of these pairs of herbs are little physiological yin-yang symbols that counter the pathological yin-yang separating. Hope that makes sense. So then you have that ozone layer, which makes you not as afraid of wind, makes you more resilient. It makes you feel emotionally more resilient. So try Gui Zhi Tang and its cousins. So how do we diagnose spleen dry deficiency? Really important is this epigastric hardness. And that hardness just means that the muscles are really tense there. And again, that's like a compensation for how deficient it is inside. And so if the muscles are tense, sometimes even you press and they sort of react to your pressure, or a sense of vulnerability, like, ooh, don't touch me there, it feels so vulnerable. That's for sure like that's Dazao, Zhigansao, Renchen kind of indication. Spleen deficiency is some scalloped edges on the tongue or weakness in the four limbs. Then the blood deficiency, you know, you can tell I love abdominal diagnosis, rectus tension. So the rectus abdominis get very tense. And that's blood deficiency and really a Baishao indication, but Baishao plus. You know, we can say Baishao, Nujenza, Dazao, all kinds of herbs like that that nourish the blood. Poor night vision, visual floaters, weak nails, weak hair, and sallow complexion is blood deficiency. And the open surface is this aversion to wind, but also the flushing up of yang and the leakage of yin, like we talked about. The pulse for Gui Zhi Tang would be the left sun floating, and the text says moderate, which to me means it's not tight. It means like the yang is floating up, but without a lot of strength. It's floating yang, it's empty yang. And that will primarily be in the left sun, because that's where the small intestine position is. Also, the left guan, because of the blood deficiency, will likely be on the thin side. And the right guan might be wiry because of the Baishao in there, the Xiaoyao Gansao Tong. A lot of times these people will get kind of stomach pain that's muscular. You know, so you have these undernourished muscles, so they're tight and not soft. And it's kind of wood invading earth, you know, but it's deficiency, wood invading earth. So you need Baishao to soften the wood, help it flow better, so it then moves off of the earth. But when it does move onto the earth and you get cramping pain in the abdomen or related to the digestion, the right guan will likely be wiry in that case. Okay, how are we doing on time? Oh, good, we have time. Okay, cold blood patterns. So we already looked at these little yin yang symbols, but we'll look at them just briefly again. We have that kidney yang within the yin that interacts, moves up in the body to create the liver blood, which is this yang heat from the kidneys with the kidney yin becomes the liver blood. And so that blood needs to be rich and juicy, but also it needs to be warm. And then, of course, we know that blood goes up, all the way up, and on the surface of the body, we call it harmonized yin and wei. So Wenjing Tong is, you know, a formula that really nourishes the blood and yin aspect. So it includes Su Tong, it's got Dangui, Chuanxiong, Xiaoyao, and it's also got like Jiao and my mendong, very much enriches the fluids of the body. So it's really this blood dryness. And it has Gui Zhi in it and Shang. So it integrates, goes from the blood and enriches the blood and brings that to the surface of the body, but deep from the Zhuiyin blood. It's also got Wu Zhu Yu in it, which really warms the blood. So what I'd like to notice here is the Zhuiyin is the great sweeping motion from the blood to the heart. In this case, the pericardium, the heart master. So it goes from the blood. Zhuiyin is the liver pericardium, and the blood goes through wood up to nourish and protect the heart. So it's Gui Zhi Tang, but it's Gui Zhi Tang that starts from inside the blood. Here you have a Gui Zhi Tang pattern because the blood is so crappy, and you have to improve the blood. You can't just give Gui Zhi Tang, right? Because you have to go down to a deeper level because the blood is so dry and the blood is very cold. So you enrich the blood and warm it and get it really nice and juicy. And then you bring that up to the Taiyang, up to the heart and pericardium. I hope that makes sense. So other formulas, Dang Gui Sini Tang, Dang Gui Sini Jia Wu Zhu Yu Shang Jiang, and all of these formulas include Gui Zhi Tang, sort of brings that warm blood to the heart. So here, harmonized liver blood as the yang heat within the fluid. Zhuiyin is the great sweeping motion from the liver blood to the heart master pericardium. When the blood's cold, crappy, and dry, with yang out of right relationship. So here, then this blood isn't available to nourish, soften, and protect the heart. And what happens if the yin aspect is all dried up and cold? What happens to the yang aspect? Partly it's weak, right? It's already cold, but partly that yang doesn't have a home. And so you get flushing up as well. And that's why the formula includes like mu dampi, and also even mai mendong bai shao are cool. And even in the text, in the Jingguiyale, heat on the palms and soles, like you get this empty heat. So in this pattern, in terms of the emotions, the heart can feel unprotected because it includes the Gui Zhi Tang pattern, but also there's this brittle coldness. It's like dry branches in winter, that the venous blood going up to the heart, is brittle and cold. And so there can be a lot of tightness and even a kind of bitterness in the heart, as well as a lot of anxiety. So, and you don't need to diagnose from the way that the emotions manifest, though, because the Wenjing Tang pattern will be so obvious from the other signs and symptoms. So, for example, we've got this Su Tong with Jiao in place of Di Huang. So that is blood deficiency, but the function of Su Tong is not to nourish the blood, not to move the blood, not to warm or cool the blood, but to harmonize the blood. And harmonize always means bringing things that have become separate back into right relationship. So it's nourishing the yin aspect and bringing the yang aspect back in. just like we harmonize the yin and wei with Gui Zhi Tang to bring that ozone layer of protection to the heart and to the surface, we're harmonizing the blood. So Dang Gui is sweet and juicy, but also pungent and warm. So it's kind of the quintessential harmonize the blood herb. It brings yang back into healthier yin. Chuan Sheng is more bringing yang into the blood. Bai Shao is more bringing a yin aspect into the blood. But all together, Su Tong, and you could thoughts with Su Tong, you could use Chi Shao, you could use Dang Gui Wei or Dang Gui Tou or Shu Di or Shang Di. You can change it, but all together, the purpose of Su Tong is to harmonize the blood. So we have this thing called systemic blood stasis, which I call crappy blood. And what that means is that all the blood in your body is kind of viscous and thick and doesn't move well. And blood deficiency, if you just think of when a stream gets low, like my stream out here is low because we're in a drought, you know, the lower it gets, the more kind of murky and slow it gets. Well, same with the blood. When you have blood deficiency, it doesn't move as well. And so not only do we need to enrich the blood, we need to improve its movement. And this is systemic blood stasis. It's not just in one place. Like all the blood of the body is viscous, and this is incredibly common to have crappy blood. And once you kind of have that concept, you'll see, you know, so many women with miscarriage issues have these thick blood issues, and it's really, really easy to treat with Chinese medicine. And the base will always be some aspect of Su Tang. So blood stasis signs, and these are signs of blood stasis, not necessarily systemic, but oketsu, which was with abdominal diagnosis. And what you're looking for is if you press deeply into stomach 27, there's a kind of rebound pain. More commonly, what you see is that around the navel, there's a lot of tension or hardness. And that's also oketsu. Oketsu is just Japanese for blood stasis. Purple tongue, painful menstruation, but some signs of systemic blood stasis: prolific spider veins, dark spots, dark complexion. So that then you start seeing, oh, this is pretty common. Also dry purplish lips, for me, are systemic blood stasis. So often you'll see an oketsu, the tongue is kind of purple, and you'll see, oh, look, on their ankles, there's all these spider veins. They have purplish on their lips, some dark spots on their skin. Then I think, oh, the blood in the body is not a good quality. And then if it's also cold, which it would be for Wenjing tongue, then they also feel very cold. They have pain in their body that's worse with cold, better with warm. These are all kind of obvious things. Also remember that Wenjing tongue is a dry blood pattern. So you'll see dry skin, dry hair, dry mouth. The tongue might even be small or very thin because the fluids are diminished in a Wenjing tongue pattern. So it's very juicy formula, and so in terms of depression and anxiety, does that seem clear how a Wenjing tongue pattern could lead to both some dark depression, but also to anxiety, you know, sort of hyperactive anxiety, palpitations. So that's a question. I'm going to look for the answer in the chat. You can just write in, yes, sir.
Sharon,
Yeah.
there's a question, someone that's relevant to what you're speaking about now. Someone asked, can you ask how long it takes to turn crappy blood around?
How long what?
How long does it take to turn crappy blood around?
Oh, it really can vary a lot. You know, sometimes, well, you know, one thing is that blood stasis, even if it's systemic, it's always a branch. So you always have to look at the root. And in a second, we'll look at another pattern where there's crappy blood that's not Wenjing Tong at all. So Wenjing Tong is just one crappy blood pattern that is cold, stagnant, dry, deficient blood. Now, it really depends. Like, I'm thinking of this person that I saw who had systemic staph infections. She kept getting these boils on her body, and she took antibiotics and they'd go away, but they would just come right back again. And so she came to me, and it was actually many years ago when I was first learning about classic formulas and, you know, starting to trust the pattern more than the disease. And I remember like, wow, she's got staph infection. You know, what do you do first? How do you treat staph infection? And I thought, I'm not treating staph infection. I'm treating a pattern. And she had really painful menstruation. She was very thin, very dry, very cold. And her menstruation pain craved warmth. And I was like, this is Wenjing Tong pattern. And then I thought, can I explain this chronic staph infection with a Wenjing Tong pattern? And I thought about it and I thought, well, what's going on the surface of her body? The yang is not in a healthy position relative to the yin. Like the surface of her body is really weak and open. And the yang is leaving her body before it has a chance to arrive at the surface and be held by the yin aspect. So that's the yin wei disharmony. But also her blood is so cold, you know, it can't even bring that nourishing warmth to the surface. And so I took a risk and I'm not going to do anything for the infection. I'm just going to treat the Wenjing Tong pattern. And lo and behold, like her current staph infection cleared up and she never got another one again. And also her dysmenorrhea, that first pattern, that first period, she no longer had pain with that menstruation, and that lasted. So, I mean, I treated her for a few months, and she was a barista at a local coffee shop, so I got to check in with her. And so one thing about cold patterns, just in general, is it's always good news for me when someone has a cold pattern, because cold can cause a lot of suffering, and it can cause a lot of complicated signs and symptoms, but it's so easy to treat. All you have to do is like melt the cold. You know, it's like if a kid is in a cold swimming pool and they get out of the swimming pool and they have purple lips and purple fingernails, like they have terrible blood stasis, you know, all they need is to lay in the sun for 5 minutes and it goes away. So for a Wenjing Tong pattern, often taking care of some of the major symptoms, and I'm sorry about the barking dog. That's a visiting dog who I'm caring for a friend. Anyway, the symptoms will go away pretty quickly, but you'll want to follow up and really build the blood for a while. But some of the really painful symptoms will go away quite quickly with this particular pattern. And Dangui Sinitong is Gui Zhi Tang plus Shishin and Dangui, and it's not so dry and deficient as a Wenjing Tong. It's more that the blood vessels and the channels are frozen. And so it just brings a lot of warmth to the blood, but it doesn't nourish the blood nearly as much as the Wenjing Tang. The person isn't withered. You know, for me, Wenjing Tang, I see as the person is withered. And even if they have a large body, they're dry inside. So Dongui Sunitang, just cold and pain, but we're talking about depression and anxiety. The Dongui Sunitang pattern, it also has Gui Zhi Tang in it, and so it can definitely lead to anxiety. That pattern can lead to anxiety, and you see, oh, they also have pain in very cold hands and feet, maybe even the tip of their nose or their nipples are really cold, anything that sticks out. And they have depression or anxiety, and you bring in the Dongui Sunitang, and it's very much relieved. So again, we're explaining the anxiety and depression with the pattern. Okay. So here we're going to look at another crappy blood pattern that's really common. And I just love this formula. You know, you fall in love with formulas that you have a lot of good experience with, where your patients were happy. And so this is one of those formulas. So Shui Fu Ji Tang, which is not a classical formula, but it's, I think, a very useful and profound formula. So this is going to bring us to a discussion of Shaoyang. You know, so of course, a Shaoyang problem can lead to depression. It's probably the main thing we think of, you know, free and easy wanderer. We want to help. In TCM, we think about opening up the liver qi. In terms of the great sweeping motions of the conformations, here's what the Shaoyang does. So when the yang is, the light force is coming from heaven, I told you that it has to come down and it has to change direction. And it comes into the Ming Men and it has to change direction. And then it starts kind of supporting and warming and serving my body, right? And so that pivotal movement from coming down, down, down to pivoting and getting into the right position is the job of the Shaoyang pivot, right? It pivots to get, it says, like, the imperial fire rules by illumination, the ministerial fire rules through being in the right position. So to me, that means it's got to be in the right position. And we looked at Fuzi, that brings it down from heaven, which has to do with the strength of the draw. You know, how strong is the draw and how strongly is it stored? The Shaoyang has to do with, is that pivot smooth? Does it open up? And like a door hinge, you know, can I get it through the door so it goes from the outside down into the Ming Men? And so Shaoyang pathology will show up as these pivot problems. And when that pivot gets stuck, what happens to all that warmth coming down from heaven that can't get into position? It starts to get hot, right? So Shaoyang patterns easily lead to heat. And this is heat from the life force being blocked. So when we give the formula, the pivot then moves smoothly, and the major herbs are Chai Hu Huang Qin, and then the fire can come into the right relationship with the rest of the body. So the sweeping motion of the Shaoyang is to pivot that fire into position. So the formula Shui Fu Ji Tang, it includes the formula Sinisan, which is Chai Hu, Zhi Shi, Shao Yao, and Gansao, those 4 herbs. In Shui Fuji Yutong, it's Chirshao instead of Baishao, but it's still Suni-san. So we know from that the Chaihu, and I think the Zhishu as well, opens up the pivot so that that stuckness can move. Then we have Shao Yao Gan Sao Tong, which says now we can bring that healthy ministerial fire into the blood. And then the formula also includes Su Tong, Dang Gui, Chi Shao, Chuan Xiong, and Shang Di Huang. So it's Su Tong in a cooling direction, right? Because it's got Shang Di and Chi Shao. And that it needs to be cooled because the pivot block leads to some heat. Then the formula also includes Jiegong and Huainiushi, which for me means that it treats everywhere in the body. Jiegong is up, Huainiushi is down. Like we're spreading this harmonized, cooled blood everywhere in the body. We're opening up the pivot and spreading this wonderful fresh blood everywhere in the body. And the blood has gotten actually quite crappy. So we have Honghua, which is light, and Taoren, which is heavier. So again, for me, Shui Fuji Yutong is a crappy blood formula. It improves the blood quality everywhere in the body. But in this case, obviously, it's so different than Wenjing Tong, right? Because in this case, the reason for the blood stasis is this qi stasis. And it's more of an excess pattern, right? There's this blockage that's congealing the blood. And so we're opening up the blockage and it's led to some heat. So we're cooling the blood in order to help it flow more freshly. Now, I'm going to just talk about a couple of cases that were particularly depression that I use this formula for. How are we doing on time? Okay. I'm almost done. And then I'll open it up to questions. So one case was somebody who came in and he was depressed and very fatigued. And I looked at him, he's like this big guy, and he just doesn't have any other health problems except he's exhausted and depressed. And so, you know, I know, like, I'm not looking at a yin confirmation. I'm not looking at a yin great sweeping motion. It's going to be a yang one because he's a big, strong, healthy guy, but there's nothing in Yangming, nothing in Taiyang. So this is kind of ruling out diagnosis. There's really no symptoms. So how do I explain his fatigue and depression with what I see? Oh, and he had like a reddish purple tongue. So I knew there was blood stasis. He didn't have any fixed pain anywhere. And his complexion was a little darkish. So I didn't have a lot to go on, but what I did have to go on was, I know I'm in Shaoyang because it's Yang, it's not Yangming, it's not Taiyang, so it's got to be Shaoyang. And I know that there's blood stasis. Can I explain why he's so tired and depressed with a Shui Fuji Yutong pattern? For sure. You know, he's locked up and he was in a really shitty marriage that he hated, and he didn't feel like he could leave. And this was a funny case because I gave him the Shui Fuji Yutong, and in this case, it worked quite well for him. But also, soon after that, he left his wife. And, you know, so it was like he didn't feel like he could. So all this life force was just blocked and repressed. And who knows if the herbs helped him get out of his marriage, you know. But hey, I try to take credit for whatever I can. So anyway, that was one case. Another case that was Shui Fuji Yutong was a was a Vietnam vet who came. He was a smoker, and he had nightmares and panic in the middle of the night, and flashbacks from the Vietnam War, and he was in the early stages of diabetes. And again, you know, it's so fun to just follow the pattern, you know. So he had a purple red tongue, and he had so many pent up emotions that he couldn't express, wiry pulses, and again, a big guy. And anyway, just to say, it was a Shui Fu Jiu Tang pattern. And I just recently gave a talk in the White Pine Circle about metabolic syndrome and how crappy blood is like the main culprit in my experience. And he is a case of that, because with the Shui Fu Jiu Tang formula, he began to sleep without the night frights. And, you know, because we know that the blood houses the Shen. So without good blood, his Shen was ungrounded in the nighttime. And his insulin, he was able to go down on his insulin. And he just felt much easier. So those are just a couple of examples from my practice, but this is such a useful formula. So I hope I've given you a sense about these formulas of when you'd use them, what you'd look for. You know, of course, this is an in-depth study, and I'm trying to kind of give a quick overview of the main patterns that I see for depression and anxiety. It's not exhaustive by any means, but hopefully this gives some tools. So with diagnosing the pivot issues, anger issues, like especially when it's smoldering, simmering anger, or where it busts out in rage attacks, or just pent up emotions, lack of expression, I really look for a wiry left guan. A crypt tongue is like a really tense tongue. Subcostal fullness, and I talked about the ruling out diagnosis. So, Sunny-san is the pivot issues plus blood deficiency. It includes Xiao Gan Xiao Tong, so you often have undernourished muscles. Where Xiao Chai Hu Tong is more of a pivot issue that can easily cause, you know, the same kinds of pent up symptoms, but with Xiao Chai Hu Tong, because it includes Ren Shen, Gan Sao, Shang Jiang, it's also got kind of a spleen damp deficiency as opposed to spleen dry deficiency. And both of these patterns can have such an incredibly wide range of symptoms. So we're looking for the kind of key pattern that explains the symptoms. That's what we spend a lot of time in the graduate mentorship program, learning how to work with this plethora of symptoms our patients come in, what to not pay attention to so we can get to the heart of the diagnosis. I think maybe that was a little clear in this presentation. Here are some Chai Hu formulas, like there's Chai Hu Gui Zhi Tang, which is a combination of Xiao Chai Hu Tang, Gui Zhi Tang, Chai Hu Jiao Gu Muli Tang. Okay, so that's it, and the timing is just about right. I'm very happy to answer some questions if you want to.
Okay.
Are there any questions?
Thank you, Sharon. So before we start the Q&A session, I just want to thank Sharon first, because I know it's a little bit past 8 o'clock. So on behalf of the group, the Chinese Medicine Practitioner Meetup Group, and also on behalf of ASNI, Sharon, thank you for being so generous with your time and your knowledge. And we appreciate not only for tonight, but for all the good work that you do for the profession. So how do we do it, Amy? Like this is how we clap. Thank you, Sharon.
Thank you.
Okay.